Exposed tooth necks are something that worries a lot of people. Why do the necks of the teeth get exposed like this? And why is it in this patient only up to here, but for example, not on these teeth? She was told it was from brushing, as many patients are mistakenly told. The brushing? Your brushing is what's causing this gum recession. Yes, but why not on the molars? Why not on these two? Why a little on this one, a bit more here too, and even more on the canines? The ones in the center here, these a little, these not at all, this one yes. I mean, do you think that if the patient brushed badly, she would brush this one badly, but not this one? Or this one over here a lot, but this one less and this one not at all? You mean she doesn't brush her molars? Friends, we need to broaden our understanding a bit. We need to have more clarity in our ideas so we don't tell the patient something that will surely cause a problem. Why? Because this patient, thinking that her tooth necks were being damaged by brushing, what did she do? She stopped brushing. And why did she stop brushing? Out of fear of continuing to cause a problem. So in that case, we're not just telling her something that isn't true, we're also causing another problem, which is a lack of brushing. And we're not seeing the root cause of what's causing this exposed neck. Now, if you wanted to be able to see this on a panoramic X-ray, we wouldn't be able to see the complete answer. Why? Because the data we're going to see, we'll see it on an X-ray. That is three-dimensional, which is called a tomography, okay? I'm going to explain why this problem originated. I'm going to explain why the gum is receding, what we could do to prevent it or at least stop it, and many other things in this video, okay? Let's go. The first thing we have to observe in this image is that this patient had orthodontic treatment. How do we know she had braces? Because she's missing a premolar. And it's very common for a patient who doesn't have first or second premolars anywhere in their mouth to have had orthodontic treatment. And second, because she told us, obviously, right? So that's how we have to look at it first of all, okay? She had orthodontics. Nah, the bite isn't bad. If you look at the bite, it's not a pathological bite, not a bite like the ones I've shown you where everything is super wrong. Here's not bad. Obviously, the third molars are causing some interference. In fact, that was the reason for the consultation. Should the third molars be removed? Should they not be removed? And why she had so much recession. Because even though she was brushing super gently, this kept happening. Now, the first thing to evaluate is definitely the bite. Why? Because as I've said on the channel, abfractions, which is when we normally see a kind of wedge shape form on the teeth, have a lot to do with the bite and with clenching. But if we look closely at this, it doesn't have that many abfractions. Meaning, if I look at the canine, for example, it doesn't have that wedge effect that I've shown you in other videos. Therefore, this is an issue with the gums, almost 100%. The bite doesn't affect it that much. So in this case, it's not the bite, so it's not an abfraction, but it is a gingival recession. Now keep in mind, improper brushing can indeed cause gingival recession, but before telling the patient that it's improper brushing, we have to look at other factors, which are the ones I'll show you in this video, and which were the true cause of this problem, not the brushing. So we have the bite is fine, but she had orthodontic treatment, and we have to keep that in mind, and you'll understand why in a moment. So obviously the extraction of the third molars is of course indicated because the molars came in very badly. We're not going to put braces on to straighten them. She doesn't want them. Food gets trapped. But let's talk about what happened here. Why only on this side and not on the whole tooth? These are the things that really explain why this is happening. Because on these molars, she has practically no loss at the necks like she has here. How will we know? With a 3D tomography, as I mentioned. A simple X-ray is not going to give us this information. Why? Because it's not going to give us three-dimensionality, which is what we need to know what happened with this patient. First, I'm going to give you the example of a panoramic X-ray, and I'll explain why this problem can't be seen on it. This is the panoramic view, what we would see in the patient's panoramic X-ray. And if you're asked for a panoramic X-ray to diagnose this, this is what you'll find. A two-dimensional image. In other words, we don't see 3 dimensions here. Why? Because I see the bone, an average bone level, in relation to the tooth, whether there's bone loss or not. But what I don't see is the front and back, meaning how the bone is from front to back. And that is what will determine if that gum recession is due to lack of bone. Because if I see the bone is fine here, I can't assume that the bone is also fine in the front and back. The bone on the sides is fine, but it can be lost in the front. In fact, I'm going to draw it. This is worth drawing. This is the patient's bone level. Okay, I'm also going to draw it up here. It's the bone level, and so far we agree. The bone level between the teeth. But when you see the bone here in front, it's not necessarily going to be like that. The bone can do this, or it can do this, or this, or this. We're not seeing this. We think the bone is fine. We expect that when you see bone loss like this, it's because it's lost on both sides. But no, that's not necessarily true. You can see a large amount of bone here at this level, and then it does this. And this, my friends, is what the tomography gives us, and what the panoramic X-ray cannot, because you are seeing it here live, just as I am. There is no way we can see this, and I'm going to prove it to you with the tomography. For this part, I want you to pay very, very close attention, because it's truly complex to explain. I want you to see we are looking at the level of the second molar. Do you remember that on the second molar, you'll see some images in a moment of how the gum looked fine? You couldn't see any gum loss, okay, on the second molar. But I want you to see what happens here. This is an image taken from this cross section. That is, if I cut the patient here and open it up right about here, and I open it, I have this. This is the image that's worth its weight in gold. And in this case, the bone that it says is here is indeed present at both ends, meaning both here and here. Let's see if I can zoom in a little more. Both here and here, the bone is at the same level. So it matches this level. So for that reason, on that tooth, we do see stable and nice gums, which is what we would expect to see. But what happens on the next tooth? Let's move on. Notice how when I move this image, it moves over here, okay? I'm going to move over here, okay? And there I am on the first molar, and I'm automatically observing, please look at how clear it is. Here, the bone is no longer where it should be here. It's down here now, see? It's not here, it is dropped all the way down here. And so since the bone is what supports the gum, when the bone drops, the gum also drops. And so we have that the bone level on this side is really good, but over here it's very low. In the tomography, we can see this in 3 dimensions. In the panoramic view, we see the same line. How do we see it? Like this. So if you see the bone here, you're going to say, hey, well, it looks practically the same. Look, it's at the same level. Yes, because this part over here is giving us that false image of a stable bone. But if we look at how it is in the front, what do we see? The bone is lost all the way down here. What about the one above? The upper tooth is going to have the exact same problem. Look where the bone is. There's no bone here. There's only bone up to here, but there is bone here. So if I look at the image, I do see bone here. I see bone perfectly well. But when I look at the bone on this side here and I no longer see it all the way up, that's why the upper tooth has very high gums. Let's look at the canines, which were the most affected tooth. For the canines, here we're going to have a very clear image of where the bone is. Please notice how it looks, how the bone has been lost and the canine is kind of sticking out of the bone. And you can see it here. The bone is all the way up here, meaning there's no bone down here, therefore the gum is going to be very high. And back here, the bone barely reaches here. You can see it very well here. In fact, I'm going to put the image right where it is here. The bone ends here. It's a very, very thin plate, huh? Don't think it's a lot of bone. This patient has very little bone on the canine, but the key is where the bone ends on the front part of the tooth. And here we see it on the canine, how the bone is all the way up here. So if the bone has moved up to here, the gum will go all the way up there, obviously plus those 2-3 millimeters of biological width. But in reality, we're going to see how it gets quite exposed. Therefore, in this patient, the canines, since they don't have good bone support, at least on the vestibular side, they have that gingival recession. This is not from brushing, my friends. This is not from brushing, and we can't say it's from brushing when the problem is a bone problem. Because if we tell the patient it's from brushing, they'll never find out it was a bone problem, and they'll believe their whole life that the toothbrush caused this. And every time they go to a dentist, they repeat it. It's that I brushed too hard. It's that I brush, and they've already labeled themselves. And the worst part of all is that that's not the problem. And the real problem is not being seen, and it's not being treated. Do you remember that of the 2 central incisors, the right one had more root exposure, meaning more gingival recession than the left one? Let's compare those 2 teeth. If we look, we're on the right side, the right one, the bone is up to here. I'm going to place it more or less at the level of the blue line. The bone is up to there. Therefore, the gum receded slightly, but it receded because the bone level is very high. Let's look at the other tooth. Look at the difference. The bone is more or less at this level. That was the difference between one tooth and the other. So we had more bone loss in one tooth than the other, and for that same reason, the gum on that tooth receded more. Now, you're probably going to ask me what was the cause of this, right? Because, okay, we already know it's bone loss, but why was there bone loss? This is where we have to think like we're investigators on one of those rare, complicated cases, you know? And it's not that complex if we look at it from the beginning. The young lady has had premolars extracted. Most likely, she didn't have enough space. In other words, her teeth must have all been somehow kind of crowded on top of each other. It's called dental crowding. Therefore, to create space for that crowding, they had to remove her premolars. So they moved the teeth, but by not expanding the maxilla, or when trying to align the teeth, a lot of bone can be lost. Or even the teeth, since they were crowded, may not have had enough bone to begin with. Does this mean it was the orthodontist's mistake? Not necessarily. What had to be done was done to align the teeth. And in some cases, orthodontics allows the bone to move with the tooth. But in other cases, unfortunately like this one, the bone is reabsorbed and disappears, and the teeth end up a little outside the bone, because that was the position sought for the patient. Unfortunately, in this case, the patient no longer has enough bone, and thinking about another orthodontic movement would only cause more of that bone to be lost and the gum to recede even further up. So what can we do for this patient to prevent this from getting worse? This is where we need to use corrective and preventive dentistry. We can correct the gum, yes, a little, and I'll explain how in a moment, but we have to prevent this bone loss from continuing. How? Number one, the teeth can't move anymore, meaning the tooth has to stay in its place. If the young lady starts clenching or her teeth shift more due to age or growth, more bone could be lost. Therefore, since she's in her 30s, she's not going to grow anymore. Therefore, we have to keep those teeth in the correct position with guards. What the guard will do is hold the teeth so they don't keep moving. It has to be a well-planned guard, not just any piece of plastic. A guard that also ensures her joint is fine, without increasing the dimension too much. All of this is so that her tooth stays in position for a long time. Second, hygiene. Even though we said that brushing has nothing to do with what's happening, if she brushes too hard, obviously since she has a thin gum biotype, it could indeed be a bit more harmful. Therefore, it's not that she should stop brushing, but that she should do it carefully. If she stops brushing, it's also harmful, because then you get periodontal disease. With that, it would cause the gum to recede much faster. So you have to maintain hygiene, but not abuse the force, but you do have to clean it. It's a very fine line, but it can be maintained. And third, obviously, once we know what the problem is, we know how to treat it. So you can't do a bone graft, my friends. A bone graft will definitely not work in this case. Why? Because the bone that was already there was lost, and if we had more bone, we still don't have the gum biotype. We don't have the gum to support this bone graft. And besides, the bone is not going to attach to the tooth. Why? Because that tooth has already lost the layer that is between the bone and the tooth. That ligament is already lost. Therefore, if you put a bone on the tooth like this, it won't attach, it will be lost. It can't be done anymore. The only thing that can be done right now is a connective tissue graft, which is obtained from the palate or from another part of the body like the tuberosity. And that connective tissue graft will make your tissue stronger. We are going to change the gum biotype, and it will go from a thin and very fragile gum to a more robust and stronger gum. And we can lower those gums that have receded a little, not 100%, but they can be lowered a bit more to cover those recessions a little, but by changing the biotype. In other words, the treatment is 100% periodontal for soft tissue. The bone cannot be placed here. That bone will not work. You can try, and believe me, it is very difficult for this bone to attach, but the gum can help as long as it is done with a good technique. And why do I tell you with such certainty that it can be solved in some way? Not 100%, but with about 70-60% gum coverage. Because there is something called the papilla. The papilla is what's hewn. This is the papilla, this is the papilla. If we have good papilla levels, we can recover some of the arch. If the papilla was lost, meaning if the bone was lost horizontally, it moved up horizontally, the typical example being the black triangles we have here. In that case, then the success rate is much lower. In this case, as you can see, we do have papilla on this side, we have papilla on this side. Therefore, lowering this a bit surgically and placing the connective tissue graft here could provide coverage. I insist it won't cover 100%, but we can achieve 70, 60, hopefully 80% coverage. And there is something very important that we have to talk about here as well. This patient's outcome will depend a lot on her having good health. I'm not talking about dental health, I'm talking about general health. We have to avoid developing diseases like diabetes, diseases that ruin our blood microcirculation. Of course, smoking is strictly forbidden because then the blood microcirculation will cause the bone to be lost. Why? Because the blood microcirculation is responsible for ensuring that the bone supporting this gum is not lost. That very thin, very small bone depends 100% on the capillaries, on the blood microcirculation. If we have any disease that affects blood microcirculation, this will be compromised. I'll give you some diseases, for example, diabetes, hypertension, hypothyroidism, metabolic syndrome, insulin resistance, vitamin D deficiency, Sjogren's syndrome, lupus erythematosus. Any heart problem can also affect circulation and blood microcirculation, and so on. Therefore, as long as this patient keeps her body healthy, with good vitamins and a good diet, it will be less likely that this will continue to happen. And for that reason, my friends, in dentistry, we can't just look from the teeth outward, we have to look at it the other way around. Everything the body entails, everything that has to do with holistic care, studying the patient, with blood tests, examining them, because that way we can provide a better solution for their case, and we're not just going to say brush your teeth or don't brush your teeth too much because you might lose your gums. That's today's lesson. I hope you liked this video. Let me know your questions. What are your thoughts? Remember that this channel is made for your benefit, to improve your health. If you liked it, leave a like. Don't forget to share it and subscribe to the channel to keep watching videos like these. Be well. See you in the next one. Bye-bye.